Diolch yn fawr iawn. This is Endometriosis Awareness Month, so let me begin this debate by thanking the many women throughout Wales who've contacted me over the last few days and weeks to tell me their personal stories of the challenges they faced with diagnosis and treatment for endometriosis. And my thanks also to those campaigning organisations which include people with direct lived experience, such as Endometriosis UK and FTWW, Fair Treatment for the Women of Wales, who've met us here in the Senedd and in virtual meetings, and they provided us with further information in advance of this debate, and also organisations like the Royal College of GPs, Royal College of Obstetricians and Gynaecologists, and Plan International, who've lent their authority to the Menstrual Wellbeing Campaign. And finally, my thanks to colleagues for their widespread support across the Chamber, and especially to Jenny Rathbone, Joyce Watson, Jane Dodds and Jack Sargeant, who will be speaking, if you allow, as part of my time allocation this evening, Llywydd. So why am I speaking today when women can and do speak powerfully on this themselves? It's because men also need to be willing to champion women's health and endo too. This can't be put into the box of too difficult or inappropriate or too sensitive for men to engage with. It is our families and our friends, our wives and our daughters, nieces and aunts who need all of us to speak up with one voice. And that's why I'm really glad to speak up today alongside my other colleagues in the Senedd. Endometriosis affects at least 1 in 10 women, girls and people assigned female at birth. Yet it takes on average 9 years currently, to diagnose endometriosis. Yet one woman who shared her story with me tells me of diagnosis with endo in 2015 after nearly 20 years of painful, debilitating periods, 3 years of fertility issues, of GPs repeatedly refusing to refer the condition to specialists suspecting endometriosis and having eventually to seek private treatment. She is, by the way, one of those organising a petition to Jack Sargeant's committee, which is already 6,000 strong and growing. And she told me, the majority of patients you speak to are having to fight to access care, and even when they do, the wait times are huge. And even though the endo nurses, she says, are a fantastic resource, they don't have enough specialist surgeons to refer patients to, and they can't discharge us, as this is an ongoing chronic illness. And others who've contacted me describe how they feel they've been subject to what they call medical gaslighting, how the support varies so much from area to area. Powys in Mid-Wales, by the way, have been particularly highlighted by some for special concern. And the stories can be harrowing. One woman has told me of the devastating impact endometriosis has had on her life, how she is under multiple consultants, including endometriosis specialists, colorectal consultants, urologist consultants, pain management, general consultants, how she's had 15 surgeries for endometriosis, including having her large bowel removed, leaving her with a permanent ileostomy, a stoma bag, a long-term catheter, which will soon be a urostomy, a second stoma due to bladder failing, sacral nerve stimulator, and a radical hysterectomy, leaving her in full-blown menopause at the age of 28. In desperation, she has spent thousands on private surgery and treatment. She says, her quote, "This disease devastates lives. It's debilitating, relentless, and incredibly life-altering." Now, I've heard similar stories from my own constituents. I was totally floored by the scale of medical and social and relationship and personal and financial impacts this can have if it is not spotted early and diagnosed and treated effectively. And therein lies the way forward: early identification and diagnosis, and the availability across Wales of a wide menu of treatment and care and support before the condition progresses. Now, we know that many ideas are being considered as part of the Women's Health Plan, but here are some of the proposals from the women facing these challenges daily and from the campaigning organisations. Firstly, the endo nurses are a great innovation, but they're not widespread enough, and it seems that each health board is doing completely different things. There needs to be equal access to services and provision across the country, no matter where you live. Secondly, all women with endo should be able to access an endo nurse or a similar person with specialist knowledge of endo if they have any questions, regardless, by the way, of whether they plan to go to NHS or private or a mixture with their treatment. Understanding, for example, all the different hormone treatments and surgery options is a minefield, and consultants have limited time to discuss these things, including the risks involved. So support groups facilitated by an endo nurse or a similar expert that women could attend across Wales would be an absolute godsend. And health boards need to work together more and share information more efficiently. Endo treatment can cover specialists in many health boards and trusts, including in England. So the timely and effective sharing of patient data and joined up treatment is critical. And we really need to implement in full the recommendations of the Endometriosis Task and Finish Group report from 2018. And this included that knowledge of menstrual health must be embedded within the education system, and resources must be developed to support this for the whole of Wales. Now, we have had a big step forward in 2021 with mandatory menstrual wellbeing education included in the new Relationships and Sexuality Education Code, part of the new curriculum for Wales. That's good. So we now need to ensure that menstrual wellbeing education is implemented thoroughly. Endometriosis needs to be made a priority for the training of GPs and for ongoing, continuing professional development. Too many have told me of the lack of understanding or sometimes the seeming gaslighting by GPs and others. And this knowledge should include less common symptoms such as skeletal pain and discomfort, and promote the benefits of a wide range of treatments, including pelvic physio and understanding the treatment for vaginismus, as well as other gynae issues too. And secondary care must be involved in implementing the recent NICE guidance, strengthening the care pathways for women. Referral pathways to tertiary care for all of Wales must be clarified and enforced as a matter of urgency, and the information be available for clinicians and patients. And tertiary care capacity must be increased and adequately resourced. We have to also support the full implementation now of the NICE guidelines on endometriosis diagnosis and management in Wales, as laid out in the Endometriosis Task and Finish report. Some work has been done underway to implement the NICE standards, but there is more work to be done. And Minister, we need current endometriosis care capacity to be assessed again and addressed in line with the recommendations of the Endometriosis Task and Finish report. The Royal College of Obstetricians and Gynecologists published a report last year, the Left for Too Long report, that found that as of December 2021, gynae waiting lists in Wales have increased by 62% since the start of the pandemic. The lengthy waiting times can be partly attributed to the lack of specialist services for endometriosis in Wales. So we need that strategic planning to ensure there are sufficient specialist endometriosis centres in Wales, given the prevalence of the disease and the current waiting times for diagnosis and ongoing care. And we need greater capacity to unblock the backlog from COVID. So look, I'm bringing this debate today for all those brave women across Wales who told me their story, including, I have to say, my niece, who's been waiting for well over a decade since she was a teenager for exploratory treatment of possible endo. She only had her MRI last month. She told me, only 15 years later have I finally been listened to. I had a 20-minute phone consultation with a consultant. I cried because I felt listened to, and my symptoms finally validated. I've now had the MRI scan, and I'm on the waiting list for a laparoscopy. Or another who wrote to me and said, my daughter's 7 years old, and I don't want her generation to come up against the same difficulties myself and many others have had to. So for all those, the 1 in 10, we need to build on the steps we've taken, but we need to do better and go faster. As Carly Crocker, with a shout out to her, as founder, chair and group leader of Swansea and Bridgend endometriosis support groups, tells me, although great change has been made, we've got to go so much further. So Minister, we look forward to your response after we've heard from other voices in the chamber and from right across Wales. Diolch yn fawr iawn.
Jenny Rathbone.
Thank you. Well, much progress has been made, but there's still a hell of a lot to do. Why is it that when 1.5 million people in the UK suffer from endometriosis and we do not know what causes it? So there's an awful lot of research to be done by both the experts, the expert patients and the clinicians. Last week, I chaired an online discussion with a panel of experts, including 2 very experienced consultants, Nahid Gul, a surgeon, and David Rowlands, a gynaecologist, both with a specialist interest in endometriosis, both training in minimal access surgery, including endosurgery. Together, they're building the team required to operate 3 diagnostic units and a surgical centre for the population served by Betsy Cadwallader Health Board. There's another specialist team being developed in Swansea, which is taking the load off Cardiff, which is, until now has been the only secondary and tertiary unit in Wales. The specialist endo nurses are improving the education of GPs and gynaecologists so that women no longer have to wait an average 8 years to even get diagnosed. For many women, endo dominates their lives, and on the Endo March last Sunday, I met Carla Edwards, whose endo severely restricts everyday activities most of us take for granted. But modern telecommunications enables her to be part of the international research team headed by Dr. Nasad, the most experienced endo surgeon in the world and founder of the worldwide Endo March. His endometriosis risk app helps women identify endo faster. And in Hungary, endo warrior Adrienne Salomon has developed a menstruation app called Lucy with the gynaecologist Dr. Bokol. These apps won't cure endometriosis, but they help women advocate for themselves at medical appointments where people are being gaslighted. Most treatments involve hormones or invasive surgery to keep endo at bay. Nobody knows why it has developed, and it doesn't cure them. Interestingly,
Jenny,
in Hungary,
conclude, please.
Rehabilitation treatment in using thermal springs, physiotherapy, breathing techniques and abdominal massage is available to Hungarian women, and they are judging the success of it at the moment on the fertility rates that are achieved by women who have great difficulty, obviously, in getting pregnant.
Jenny, you need to conclude because you've used more than your time.
Done. Thank you very much.
Joyce Watson.
Diolch pro clywed, and I want to thank all the women who have given and shared their stories and the experts who have shared platforms with us. And I want to talk particularly about Powys Teaching Health Board. And what we've been told is that none of the visiting gynaecology consultants specialise in endometriosis or have an interest in the condition. That's a serious statement, actually. So those people have to travel to other Welsh health boards and over the border. And okay, you know, we can't have things everywhere. But the problem here is it's become a postcode lottery. And we can't have a condition where it affects 1 in 10 women, where those women are telling us that it's a postcode lottery, first of all, in getting to see a specialist, even knowing where those specialists are and what the treatments are available. And the concerning thing for me was that nurses are excellent. On the web cam that we were on the other day, the endometriosis nurse in Swansea said the GPs didn't know she existed. So I think there's some work to do there. Thank you.
Jane Dodds.
And thank you very much to Hugh as well for bringing this short debate. And I do really want to thank others here who stayed in the chamber of both genders and across all of the parties. Thank you for staying with this and listening to this, because it is appreciated. I just want to also touch on the fact that where I live in Powys, there is no specialist services and we do have to travel across the border. In North Wales, the nearest endometriosis specialist centre is currently in England, and while arrangements do exist for cross-border referrals, they are hard to secure. Hopefully, in Betsy Cadwallader in the future, they will include plans for surgery on endo in its next integrated medium-term plan. Just for those of you who don't know the effect that it can have on people's lives, my husband actually works with somebody who has endo, and he describes that on a daily basis she is in absolute agony, sometimes unable to stand. There is very little for her and no treatment, but she continues to come into work and she continues to get support. But what that person needs, and what we need in Wales for all women is the ability to have both the referral, both the treatment to come as quickly as possible, and the ongoing support. Diolch yn fawr iawn.
Jack Sargeant.
Presiding Officer, can I start by thanking Hugh Irranca-Davies for bringing forward this important debate today, and I also pay tribute to campaigner Beth Hales, who started a Senedd petition on endometriosis in Wales. And campaigners like Beth are raising the profile of a condition that impacts so many people, yet still is widely not recognised or understood. As Hugh's alluded to and colleagues have alluded to, it's far too difficult for sufferers to get the diagnosis, and clearly that needs to change. Presiding Officer, I spoke earlier in the Commission questions with my ambition to see the Senedd as an endometriosis-friendly employer. But that's exactly the type of scheme that the Welsh Government should be pushing through their social partnership approach. As Beth said to me on the steps of the Senedd handing the petition over, and in closing, Presiding Officer, endometriosis is not just a health issue, it's also a social justice issue.
A galwaf a gweinidog.
And I call on the Minister for Health and Social Services to reply to the debate. Lynette Morgan.
I'm really grateful to Hugh Irranca for introducing this incredibly important topic for short debate today. I hope you get better, Hugh, but thank you very much for highlighting the difficult cases that you have. And I think it's absolutely right that it's not just women who are leading the charge on this. It's really important that men understand how this impacts on so many women's lives. Now, March is Endometriosis Awareness and Action Month, and I welcome the opportunity to highlight the challenges women continue to face and to reiterate my commitment to deliver changes to the way healthcare is provided here in Wales. Because for too long, there have been deep-seated and entrenched inequalities in the healthcare provided to women, and these inequalities present themselves in a multitude of ways, including how women's experiences and concerns are viewed and symptoms acted upon. And this is particularly so for issues and conditions exclusive to women. Endometriosis is a chronic condition affecting 1 in 10 women. Whilst it's most commonly active from puberty to menopause, its impact can last for life. The exact cause of endometriosis is the subject of medical debate, but its effects are clear. It occurs where cells similar to the endometrial cells lining the womb are found elsewhere in the body where they should not be. Now, these cells continue to menstruate monthly, but there's no external flow, and that can cause inflammation, scar tissue, fertility issues, and significant pain, which can at times be entirely debilitating, as we've heard. For many women, endometriosis can be difficult to diagnose and can take years to be accurately identified and treatment. Endometriosis affects women from all social and ethnic backgrounds, and whilst there are several common symptoms, the extent of the condition and the range of severity of its symptoms varies considerably between individuals. Now, sadly, despite the prevalence of endometriosis, evidence suggests that it takes on average 9 years to receive a diagnosis in Wales. And this often follows numerous visits to doctors and hospitals during which symptoms may not be recognised or in some circumstances are even dismissed. For many women, particularly those experiencing endometriosis symptoms from a young age, they may not realise that what they're experiencing is not normal. This first step of believing women, recognising and acknowledging severe menstrual pain as possible endometriosis should lead to appropriate investigations without delay. At the heart of discussions about waiting times, there are women who are often suffering in silence, whose lives are being profoundly impacted. And nothing illustrates this more than the experience of a women's health advocate who is supporting the work that we're taking forward, for which I'm truly grateful. It sounds very similar to the example you gave, Hugh. I think you gave an example of 20 years. Well, it took this particular woman 23 years to receive an endometriosis diagnosis, and her symptoms and concerns were repeatedly dismissed by doctors as being the result of stress or of a low pain threshold. She was told her concerns were simply in her head and a product of depression and anxiety. Yet, despite these incorrect labels, no referral to mental health services took place. The severity of her symptoms and the uncertainty that resulted from a lack of appropriate clinical care and support had a significant impact on her personal life and almost resulted in her losing her job. Now, that's one woman's experience, but it'll sound very familiar to far too many women. Women make up half the population, yet historically they've been disadvantaged by a lack of research and data about conditions, including endometriosis. This has constrained our collective understanding of the disease, our ability to quickly and conclusively diagnose its presence, as well as offer prompt and effective management and treatment. Endometriosis may be... Yes, okay.
Thank you very much, Health Minister. You have given signs, symptoms and conditions you described very well. Endometriosis is a pelvic condition and it involves all the organs. It's not only the uterus, it's the fallopian tubes, it's the bladder, it's the bowels. So it becomes really vague to know about it, and it needs a team effort. And thank you for giving me the intervention.
Thanks very much, and I guess that's part of the reasons why so many people are misdiagnosed or not diagnosed, because it is quite difficult to understand that, and that's why actually, I think training for doctors, for physicians is critical. Endometriosis may be suspected due to an individual symptom history or through scans, but the invasive surgical procedure called laparoscopy is currently the main way to confirm that symptoms are due to endometriosis and allow for surgical procedures to relieve symptoms and complications. Expertise and capacity are being developed across Wales to address the need for such services. There's also a clear need for further research into more rapid diagnostic approaches for endometriosis so it can be identified sooner in its course. Early treatment with hormonal manipulation is highly effective in reducing pain and complications, including surgical and fertility problems, but this, of course, depends on early diagnosis. It's with regret that the Health Service's response to the pandemic, whilst necessary, has negatively impacted access to care in Wales and across the UK for a range of conditions, including endometriosis. And sadly, difficult decisions have only added to the protracted timescale for diagnosis and treatment already being experienced by women. Health boards are responsible for providing their local populations with high-quality care and support for the management of endometriosis. Now, Wales has 2 fully accredited endometriosis specialist centres, University Hospital of Wales and Singleton Hospital, as well as an endometriosis specialist centre at Royal Gwent Hospital awaiting accreditation. I understand there is some moves afoot in Betsy as well. There are, of course, areas of good practice across Wales, but not all clinicians have the confidence and expertise to correctly identify and attribute endometriosis symptoms, as well as provide ongoing care and support. So there is a clear need for improvements in training, skills and awareness, as well as access to specialist advice and treatment where that's required. And in recent years, there have been several important developments here in Wales in advancing the support and care available to those experiencing endometriosis. So we had a task and finish group, and that was established following the receipt of its report in 2018. And what happened is the Women's Health Implementation Group was created to take forward its recommendation. And that led to endometriosis nurses and pelvic health coordinators being appointed in each health board who actively spend time with patients in clinics and liaise with their multidisciplinary teams to improve endometriosis service provision across Wales. A dedicated website has been developed for patients and clinicians. Endometriosis Cymru includes living with stories from Welsh people and a symptom tracker, which has the potential to become a diagnosis tool for patients and clinicians to speed up intervention for early diagnosis and treatment of endometriosis. Additional resources have been created, such as the Bloody Brilliant website, to provide evidence-based guidance and help normalise conversations around menstrual health. Now, despite these developments, the current waiting times for diagnosis and treatment and the powerful stories we all continue to hear from women right across Wales suffering from endometriosis demonstrate that much more needs to be done. And I'm committed to delivering improvements for these women, and that's what we're working towards.
I've been clear that we must change the way we provide healthcare to women and girls in Wales. We need to do that so that they can get timely care, so that the NHS responds to their needs and requirements, and so that research and development work reflects the lived experience of women and girls. And that's why we here in Wales have committed to bringing all of these important issues together in a women's health plan, which is being developed and owned by our NHS here in Wales. And we have already taken important steps towards creating that plan. In July, I announced the Women and Girls Health Quality Statement, and this sets out what the NHS is expected to do to secure quality health service to support women and girls throughout their lives. There is a clear expectation placed on health boards to ensure appropriate levels of care, treatment and support for women who experience endometriosis, so that they are cared for as close to home as possible without lengthy waiting times. Then in December, the NHS cooperation team published a plan on establishing a Women's Health Foundation. This reports from the perspective of more than 3,800 women and girls from all corners of Wales and draws attention to what is seen as gaps in current provision, and the document sets out opportunities to improve women's health, including access to endometriosis treatment and support. These improvements will be put in place through a NHS Wales 10-year women's health plan. Announcing the first stage of the women's health plan sets out the start of a conversation and agreement with women over 10 years using a co-production method set out in A Healthier Wales. It shows a clear commitment that the women's health plan should be driven by the voices of women and girls in Wales. The plan will seek to address any unfairness or barriers in provision at the moment, using a lifetime approach to ensure that quality health services are available to women throughout their lives. Following the National Clinical Framework, the Women's Health Network is being created this year, which will create a more strategic and systematic approach to coordinating, supplying and securing health provision for women across Wales, and to help to tackle the lack of research and data about women's health conditions. My officials are working to create a Women's Health Research Fund. Endometriosis is essentially a medical condition, but it has broad-ranging implications. We need a socially modelled approach to ensure that women are supported throughout the process of diagnosis and condition management, and the NHS needs to adopt this approach as an employer to ensure that it's servicing its own workforce in the best possible way and promoting the well-being and productivity of its staff, and that's exactly what we're doing in Welsh Government. Jack Sargeant has said that we need to show the way, and that's exactly what we're doing. I'm pleased to confirm that the Welsh Government has taken first important steps on this journey already by signing up to menopause and endometriosis commitments for its workforce and by appointing champions. This means that the organisation is committed to develop a working environment and culture that supports women in reaching their full potential, and I am confident that we're on the right track to address the lack of equality, effective women in healthcare, but it's important to recognise the scale of the changes needed and that they won't happen overnight. We are working in partnership with representative groups and partner organisations, and most importantly women and girls in Wales, in order to ensure that the NHS does respond properly to their needs. During Endometriosis Awareness Month, as well as in following months, our focus is to create a fundamental change in the way that the health service deals with endometriosis and women's health, and to ensure a permanent change for women here in Wales.
Thank you, Minister, and thank you, everyone. And that brings today's proceedings and this term's proceedings to a close.